What do you think about knee arthroscopy? Common reasons for procedure. Knee arthroscopy addresses issues like torn meniscal cartilage, ACL or PCL injuries, and misaligned knee caps. Procedure: surgeons make small incisions to insert a camera and tools, allowing them to view and fix knee issues with precision. Benefits of arthroscopy: this technique offers less postoperative pain, quicker recovery, and a reduced risk of infection compared to traditional surgery. Recovery insights: most patients begin to regain function within weeks, with full recovery and return to normal activities typically within 4 to 6 weeks. When to consider surgery: consider knee arthroscopy if you have persistent knee pain or limited function that doesn't improve with other treatments. If you're experiencing knee issues, consulting a healthcare provider can clarify if knee arthroscopy is suitable for you.